big decisions. There we go. Now, when you learned ethics, many people learned the 4 principles, the 4 biomedical principles. These are standards. These are the pillars of ethics in bioethics. So respect for autonomy, which means that we want to respect the independence of the patient's decision-making. And we don't want to have decisions that we feel that we force them to make. So we want unforced decisions. We want beneficence. And this really has to do with contributing in some way to the patient's well-being, to be beneficent is another one of our bioethical principles. And maybe the most important one is the non-maleficence, which is to do no harm. And we know if we do anything, please do not make the situation worse. Do no harm. And the 4th biomedical principle, ethical principle, is justice. And this has to do with fairness, with equity, okay? What one person gets, the other one also gets, okay? How do we make sure that we're fair and we're equitable in our care? But I want to teach you about another brand of ethics that oftentimes, I never heard about it until I went to study ethics. I was a clinician for 30 years, and nobody mentioned narrative ethics. But I think it is so important, and for any clinician in the room, this is very relevant. It's about storytelling. So in other words, how do you learn the patient's story? What's important to them? What are their values? What matters to them? So in other words, you're learning about the patient and you're establishing a relationship. So narrative has to do with the storytelling. You learn about the patient's perspective. And rather than it being a focus on the crisis, what to do, it has more to do with understanding how did the patient get in this situation and how can we move forward? Where can we go from here? So I put this down to remember narrative ethics. What's your story? Tell me your story. Okay? Many of you might know Winnie the Pooh, the 100-acre woods. This is a picture of the 100-acre woods. And I like to think of narrative ethics, and there's a woman named Martha Montello who teaches this. It's like learning the 100-acre woods for your patient. Who's important in their life? Where are the important places? What are the important events that happen to them? So did they have some trauma? When did the illness start? What is their support system? So this is narrative ethics, learning about the patient's story and valuing it, so that when it comes time to make medical decisions, you're going to know these things. Okay? There's also the very ancient form of virtue ethics, which a lot of times we don't talk about too much. I think this is probably one of my favorites. This comes from the ancient Greeks, the Romans, okay? And this focuses on our virtues as the moral agents, as the ethical agents, as clinicians, as hospital administrators, right? What have you. This focuses on classical ethics, things like truthfulness, trustworthiness. Whoa, this just got louder. Is that okay? Can you hear me? Maybe too much. Respect, fairness, loyalty, courage, generosity. So just take a second to think about yourself. Which ones are strong for you? Which ones maybe not so much? This is a way that we can think about ourselves as the moral agent. not just the outcome for the patient, but how we can be in our work to be ethical. Does that make sense? Okay, so the virtue ethics. This is Abraham Lincoln, one of our 16th president of the United States. And this is an ethical lesson right here. He says, whatever you are, be a good one. It does not matter if you are cleaning the restrooms, if you are a security guard, if you are a doctor, a therapist, if everyone is the best that they can be. This is the virtue part of it, because we are a team. And now everyday ethics. So now I went through the principles of biomedical ethics, narrative ethics, virtue ethics. This is all background for everyday ethics. Some people call it microethics, small ethics. This is from a paper that I wrote in 2015.
Recording in progress.
Well, that's good. So this is a person, Paul Komasaroff, and he was one of the first to talk about everyday ethics. And this is his definition. He considers ethics to be what happens in every interaction between every doctor and every patient. That's big. That means all the time ethics is happening. Okay? There's just one thing I would like to say. I don't think it's just every doctor. I think it's every nurse. I think it's every therapist. It's all of us. But he was a doctor, so he was speaking to doctors. But I like to think of that more broadly. So the person who's pushing the wheelchair also is a big part of everyday ethics. They could be the first one the patient ever talks to. And if they make them feel respected and comfortable and valued, that is going to set the tone for the organizational culture of everyday ethics. Okay. Arthur Kaplan is a famous bioethicist in the United States, and I like what he teaches us here. I think this is valuable. He says, ethics concerns not only questions of life and death, but how one ought to live with and interact with others on a daily basis. The ethics of the ordinary are as much a part of healthcare ethics as the ethics of the extraordinary. So let's just think about, when we think about ethics, remember the big questions, the dramatic big questions in healthcare. Who receives the organ? Like organ transplantation. It's a big one. We might have questions about stopping tube feedings. These would be questions that go to our ethics department. Okay. Can we treat the patient without consent? They come into the emergency room. We can't get consent. There's no parent there. Here's another one. Can we withhold futile treatment? If we feel the treatment is not making any difference, do we still have to do it? Here's another one. This is a big one. Can we lie to a patient? When a family says, oh, please don't tell them the diagnosis, where does that leave us? So these are very, very big ethical questions. And in the larger society, ethics has to do with big questions like abortion, assisted reproductive technologies, euthanasia, stem cell research, COVID vaccines, and shortages. So you can see there are huge, huge, big issues with ethics. But everyday ethics takes it to the smaller, the interaction, the relationship level. Oops, hold on one second. This is a point I wanted to make, that oftentimes the big ethics is in the media. Okay, we hear about it through the media. So there's dramatic ethics, which is the big ethics, and then we have the everyday ethics here. So let's just look at how they compare. The dramatic ethics is focused oftentimes on the high tech, the new innovations. Everyday ethics focuses more on the common, ordinary interactions that we have. Taking vital signs, okay? An example. Making a blood draw, which may not seem so little for a child, right? But for us might seem very routine. Dramatic ethics is oftentimes, you see it in the acute care, the intensive care, the high risk settings. Everyday ethics is more everyday care, right? Lower risk settings. Dramatic ethics affects fewer people, like who gets the organ, okay? Versus the more common, okay? Somebody coming in through the emergency room for what have you, or needing a blood draw, okay? And as I mentioned, the dramatic ethics, oftentimes there's a lot of media hype. Everyday ethics flies under the radar, and your patient knows because your patient is with you, right? Your colleagues may know, but it isn't as splashy and it isn't as hyped up, okay? So let's take the example of Parkinson's disease. That was one that I thought of. And in the case of Parkinson's disease, the big dramatic ethics would be things like the deep brain stimulation or the stem cell research, the big improvements, okay, the biotech. But in Parkinson's disease, the everyday ethical aspects of that would be things like the communication. How do we talk with the patient? Do we tell them the truth? What's the relationship like with the team, with the nurses, with the doctors, with the therapists? And what is the quality of life of that patient? So you can see you need both. You need the big ethics, but you also need the everyday ethics. And that's where every single one of us can be everyday ethicists. Okay, so let me give you just some photos because this makes the point. Okay, this was in New York City in the middle of COVID. Okay, all the people, who are you going to take care of? This is a justice issue. How are you fair? Who gets the treatment? No beds. Who gets the bed? Right? This is the everyday ethics. I think the picture says 1,000 words. I would say to you that this can be as important as some of those very big decisions for that patient. Okay? So both matter. Here's a pediatric example. When we talk about kids, is it the asthmatic in room 18? Or does the child have a name? That is everyday ethics right there. It's not only, let me go back. It's not working. Oh, okay. Okay. It's not only how we talk to our patients, it's how we talk about our patients, especially when our patients are not there. Are we respectful? That's something to ask ourselves, right? Oops. Now I can go? Okay. All right. Let me just see. Okay, good. So I want to say Words have power. Once you say those words, the asthmatic in room 18, you can never take those back. If the child doesn't know he or she is an asthmatic, that could be a problem. So just remember, your words have tremendous power, and we have to treat them with a lot of care. So in everyday ethics, the words are that's how we do everyday ethics, through our words and our relationships. So what is it? I've tried to give you some examples, but these are situations that happen in everyday healthcare. They occur every day, every single day, multiple times a day, right? They arise often. Sometimes we overlook them. We don't notice them. And they can have huge, big, staggering implications. Okay? If you are talking about a patient outside the room about the cancer that they have, and they don't know that they have cancer, you're talking about them, you could really distrust. It could be a big problem. So that's where the words, the relationship, and the respectfulness really has a huge impact. It unfolds in our communication often, as I've mentioned. So moment by moment, word by word, we can be everyday ethicists. A lot of times we aren't consciously aware of these things. So it is becoming a little bit more ethically aware. And I like to think of everyday ethics as it's microethics. Some people call it ethics with a small e. On the elevator, do you talk about patients? That's a confidentiality issue. What happens if I hear a nurse or a doctor talking about a patient using their name, or maybe even not their name, but you can figure out who they are? What do? Do I speak to them? Do I embarrass them? Do I stop their conversation? But if there are other people in the elevator, it's a breach of confidentiality. So those are the things we may not even realize. That's everyday ethics, another example, right? So you might ask yourself, what would you do? Do you wait till you get off the elevator and say, hey, fellas, you shouldn't be talking about the patients? I haven't noticed here, Hospital Garahan, our hospital has a sign inside the elevator to remind us, please, to respect patient confidentiality. Okay. So another example, right? So again, it's the relationships, it's the attitudes, and it's our motives. And it's also our virtues, right? So here are some typical everyday ethics. How do we treat the patients, especially when we're busy? This is hard. That's a hard one. How do we listen to the patients and find out what matters to them? And how do we talk to them? Do we talk down to them? Do we use a lot of jargon? So maybe they don't understand really what we're saying. So those are other things to think about. Do we take the patient's concerns seriously? Or are we too busy and say, they're there? Like if a patient says, I think I might be having a side effect of a medication, I'm a little worried about this. Don't worry. You know, it's a common side effect, but maybe it's bigger than that. So those are the kinds of things that we would want to just notice in our practice. Do we tell the truth? That's tough. What happens if we think telling them too much of the truth is going to be harmful? Maybe we tell them part of the truth. And the next visit, we tell them a little more of the truth. Right? So these are things to think about with everyday ethics. And that maybe you want to talk about it with a colleague. Or maybe one of the ethicists here. I'm just not sure about this. And how hard do the patients have to work to get answers? That's another thing to ask. Do they have to ask just the right question? Or are you a little more forthcoming with your information? Do you anticipate what some of their questions might be? This one, is informed consent thorough? I had to go for a colonoscopy. This is the best example of this one. And the doctor said to me, she slid the paper across the desk and she said, "You don't want to be awake for this, do you?" That was it. That was the informed consent. She wanted me to sign. So she didn't have the time, but I didn't know what medicine I was having. I didn't know what was going to happen to me. So that's another thing, especially for routine procedures. Are we doing a good job, with informed consent? And the confidentiality, I gave you the elevator example. I think that's probably the best example of the confidentiality. And how do we talk about our patients when they're not there? And how do we divide our time and attention? Juan Carlos, you're up there in the ICU. You have 20 patients. One gets 30 minutes. One gets 1 minute. And the parents notice this, and it can feel unfair. Do you always start with bed space 1? What happens if you start with bed space 20 and work the other way? These are things. This is now you start to think as an everyday ethicist. What's the optics of some of the things that we just naturally do? We don't think too much about them. Okay. I just want you to look at this for a minute. Is there anything that stands out to you when you see this? Okay. One of the things that I noticed, I think I have a thing here, is this, right? There's a lot happening here. He is also lower than the patient. The stethoscope's over here. It's not about the stethoscope. Something more is happening here. And this to me, this patient is not looking at him directly, but it almost seems like he is unburdening himself a little bit. I think about this as everyday ethics. He's learning about this patient, what's going on. This man, I think he has a helmet on. So what work does he do? Was he in danger? What happened? That's the narrative ethics. All the nurses, all the doctors in the room, the therapists, we get a history. So those are the kinds of questions that we're going to want to be asking. Just like in the 100-acre woods. Who are the people that are important to you? What are the important places? What are the important events? Okay. So an everyday ethics approach, you're asking yourself things like, how do I walk into the room? How do I introduce myself? Sometimes people don't introduce themselves. And I think that's everyday ethics. Like, I think we should be introducing ourselves, right? Hi, I'm Dr. Elaine Meyer. I'm a psychologist here in the intensive care unit. And today, my hope or my job today, my purpose is to do whatever I'm supposed to be doing, right? But it's being respectful so they know who I am, rather than surprising them or just showing up or starting to touch them without even telling them who I am, right? For people who have, hearing disabilities or speak a different language, you can pick up your ID, show them the picture. Like, I'm official. I work at this hospital. You can, this is who I am. A million little things you can do. When you follow yourself or notice other people, all these things that we can do. Where do you sit? You noticed in that other picture, the doctor was like down. Okay. How do you talk? Who do you talk to? Do you talk to the parent first? Do you talk to the child? Do you talk to the grandparent? Who do you talk to first? And how do you listen? Like, are you doing the computer? And it's very hard to listen. What are the standards? And can we do that better? Right? This is a terrible picture. Sorry. I look like I'm ready to bite somebody. But I did a TED Talk. Many of you probably saw it. And if not, you can still watch it. It's still there. It's called On Being Present, Not Perfect. And I did that TED Talk in 2014 before I even heard of everyday ethics. And now when I watch it, I realize that's a lot of what I was talking about, everyday ethics. So if you watch it again or you watch it, you can be thinking about everyday ethics. Okay. And it is about being present, not perfect. Because again, in relationships, it's not like we have the right drug to give. It's how do we utilize ourselves in relationship? That doctor that put his stethoscope aside, his instrument was himself, his relationship, his talking with his patient. Nurses learn this, the therapeutic use of self. As a psychologist, I don't have any instruments. I am not doing blood draws. I'm not doing medications. I'm going in myself. And it's about the talking. It's about the relationship. So it's building that muscle for all of us. I think this is good advice. Oscar Wilde said, "Be yourself. Everyone else is taken." So every single one of us here can think about, how can I be an everyday ethicist? I got to be me. I can't be somebody else. I got to be me. I have to be authentic. We showed the TED Talk to some nursing students. And here's some of the things that the nursing students said after they watched that On Being Present, Not Perfect. Okay. These are young students. They're like 19 years old, 20 years old. And this is what they learned. And they said, we easily forget that just being there to talk and listen to a patient or family member is so important. 5 minutes can make a huge impression. Think about when you were sick or somebody you loved was sick. I remember I worked with a surgeon and I had a little 6-year-old boy come in, and he was the brother, and his 4-year-old sister was waiting for a heart transplant. And she was very, very sick. And the surgeon went over into the hallway. He kind of knelt down next to the child and he looked at him and he said, "Dana," that was his sister's name, "Dana is a very, very sick little girl. But I'm her doctor and I'm going to take care of her. And I'm going to do everything that I can for Dana." How long did that take? 30 seconds. It changed that child's life. Because every time somebody would talk about Dana, do you know what he said? He said, "Dana is a very, very sick little girl." Now, he didn't understand the way I know in working in the ICU. If you say somebody's very, very sick, I know what that means. But he had something to say. And he wasn't left out. That child was included. And so that I thought was a beautiful example of everyday ethics. Now, some people may say, "I don't have time for everyday ethics. I'm busy." It probably took that literally, it was about 30 seconds. And in the long run, it saved that doctor time and that team time. Okay. Now, the next thing the nurse says, a different nursing student says, there's no textbook out there to perfectly formulate what to do. It comes from natural tactfulness and human nature to be compassionate. And then this is my favorite one of all. This nursing student was so afraid she was going to say the wrong thing. This is what she teaches us. I have moments when patients are so upset, I have no idea how to respond. There's no formula. As a backup, I have held their hand. Good answer, right? You don't know what to say? Silence is okay. All right? This is the 20-year-old nursing students teaching us this, right? Because sometimes we think, oh, I got to do the nurse thing. I have to be a psychologist. Well, guess what? I got to be a human being first, and a doctor and a psychologist, whatever I am, right? Okay. So anybody who watched a TED Talk, I do a little, I would say it's a model of the Wizard of Oz. Okay. What do you need? What's the ingredients for these difficult conversations? So do you remember what the lion went to the Wizard of Oz for? Courage. Coraje. Okay. He went for courage. You need courage to be an everyday ethicist. Okay. Now the Scarecrow went to Wizard of Oz. This is from this movie from like 1947. I think it's an old movie, but it's a good movie. The Scarecrow went to Oz for cerebro, brains. You must have brains. Okay. You got to know what you're doing. You have to know your job. All right. You have to have courage. You have to be excellent in your job. And this Tin Man, corazón, heart. All of these ingredients are important. Have you ever gone to a clinician who was cerebral, brains? You need brains. You want somebody to have the clinical experience, the decision making, but you also really need somebody who's going to have the courage to talk with you about difficult things. And hopefully you will also have somebody who will have heart and compassion in doing that. So courage, we are going to be tested often and find ourselves in difficult situations. How about this one? You ever feel like you're walking into this? Somebody's upset. Somebody's angry. Maybe there was a medical error in the past. So you will walk into situations like this. Okay? Martin Luther King Jr. Teaches us that the ultimate measure of a man or woman is not where he or she stands in moments of comfort, tranquilo, convenience, but where he or she stands in times of challenge and controversy. I think this is a good lesson to live by. Here are some little tips, little lines that might be helpful to you as you think about having your conversations with your patients and building the everyday ethics component of what you do. Let me see if I have this right. After you listen, you could say, let me see if I have this right. And then you tell them your understanding. It deepens the conversation. Okay. And it also shows them that it matters to you that you get it right. Here's another one. If you have difficult news to share with your patient, You could say, I wish things were different. That's compassion. That's the heart. And it also, if you're going to be talking about loss or difficult conversations or difficult diagnoses, it lets them know that this affects you too. Okay? Not in the same way as the patient or the family, but as a clinician, you are affected by this. Hope. So many of these conversations have to do with hope. So I encourage you, when you're meeting with your patients, you can say things like, what are you hoping for? What are you hoping for? And if they say, oh, I want a cure for cystic fibrosis, you can say, that's a hope that many of us have. Is there anything else that you're hoping for? Then you start to find out other things. Okay, so the question's about hope. Everyday ethics has a lot to do with a hand up, helping someone so that they know that they are not alone on this journey. You will be there. Your team will be there. Mm-hmm. It also, everyday ethics has to do with the little nudge, encouragement. You can do this. We'll help. So hopefully gets you to stop and think. Another one. I just give you a moment to look at this one. I don't know what this patient's story is, but I hope he's asking, or she. I think it's a he. This is a powerful example, I think, of that connection, right? Here's another one. Probably doing some exam. I don't even know, maybe for like strength of the hands or something. I don't know. I'm not a doctor. I'm not a medical doctor. But he's looking at the patient. There's something more going on than just an exam here, right? Oh, pediatrics. This is Dr. Arnold Gold, who started the white coat ceremony for all of the medical students in the United States. And now it's in nursing schools too. Okay. So that now you put that white coat on. Okay. Now there's some responsibility that comes with it, right? A lot of responsibility. It can be a little confusing, the everyday ethics. Uh-oh. How am I supposed to start this now? Right? Arthur Frank teaches us being ethical is not about making a single decision, but about a process of feeling how one acted was as good as it could have been given the difficulty of the situation. So at the end of the day, you want to feel, I did my best. And you don't want to live with regrets. I wish I had done this. This is something that we work towards. Not every day is going to be perfect. Far from it. But that's what we're going for. The interpreter told me today she loves this slide. Okay? So again, we've got the facts, but we've also got the relationship, the cultural aspects, the language. There's so many softer things that we need. The feathers. What feathers do we take into account? Now, this is Albert Schweitzer, very famous doctor, right? German, I believe. And he had a hospital in Africa. And over the hospital, he had this sign. It said, at whatever hour you come, you will find light and help and human kindness. And my goal, I would love every hospital to have that. Your hospital Garahan. Okay, you come here, you're going to get some help. We're going to treat you with kindness. right? It's very simple. But these are the kinds of mission statements that some places actually have. And I just want to point to you this one thing here. He was a lot of things. Musician, theologian. He won the Nobel Peace Prize. But guess what he puts first? He was a humanitarian. So this is another thing to think about, right? Before everything else, I'm a human, right? There's always help. If you need help, people like psychologists or social workers or the ethicists can help. And the last little lesson that I'll give to you, this was from a baseball player in the United States. He was a famous baseball player. This is one I think about. And what he says is, there is always some kid who may be seeing me for the first or last time. I owe him or her my best. Please help me give my best. Even if I'm tired, if I'm burnt out, I got to take care of myself. But how can I do the best for this particular patient? So my hope is that I've contributed in some way to your learning, maybe to think about, I've been doing this for 30 years. I've been doing this for 5 years. Let me just take stock of how am I treating my patients? How am I treating myself? One of the things that I noticed about myself is that if I take better care of my patients, I feel better about myself. So it actually, everyday ethics, I haven't studied this, but I think it's better care for the patient, but it also does things like decrease moral distress for patients, for clinicians. It helps with retention, so less people quit. All right. So there's a lot of implications to this kind of an organizational culture, improving the patient outcomes, but also the staff morale and clinicians. Okay. So I apologize. I know I was going to leave a little more time, but I know I'll be back there. And if anybody wants to ask any questions, if people need to leave, maybe we can have them leave. And then anybody who wants to stay we can do a few questions. But thank you so much for listening. I really appreciate your attention. Thank you. Thank you.
Si hay alguna pregunta, levante la mano, que la vamos a pasar el micrófono para que la traductora lo pueda tomar, ¿sí?
Oh, you have a question. Oh, let me put this on.
Gracias. Hola, Elaine, un placer escucharte nuevamente. Hay 3 cosas que me resonaron y quiero tu opinión. Uno, ¿no? Quizás hay que volver a revisar los valores de la ética. Me quedo con la palabra generosidad. La otra que me hizo repensar es esto de la ética cotidiana, ¿no? A veces creo que uno sobrevalora que la ética solo son aspectos quizás difíciles, y veo que tenemos que repasar el hecho de todos los días. Pero el tercero, y ahí viene más mi pregunta, es esto del tiempo, ¿no? Que hoy el tiempo es muy preciado para todo, para la vida de uno, para la agenda del día, la atención del paciente y la tecnología, la atención, los procedimientos, la toma de decisiones, que hacen esta agenda del día, esos 5 minutos o esos 20 segundos que hacen la diferencia, me hace repensar si en nuestra agenda del día está la ética. En este tiempo que uno a veces es corto en la atención de 8, de 10, de 6 horas, ¿cómo hacemos con este tiempo entonces? Que decís que es tan valioso esos 20 segundos para que esté en nuestra agenda mental, ser conscientes de que quizás tiene que estar en la agenda del día la ética y verla para ser consciente.
It comes back to the time, right? How do we apportion our time? There was I think it was Thomas Alva Edison, who was an inventor. He said, do not squander time, because that is the stuff that life is made of. So what I would advise people, because I started to do this too. I was too busy. I thought I can't add one more thing on. I'm barely getting out of here on time, right? I started to incorporate everyday ethics into the things that I needed to do anyway. Like when I had to introduce myself to a patient, I started to incorporate it into that. Okay. And then I would ask them, not only tell them who I was, I would ask them, tell me how you would like to be addressed. They couldn't believe it. I asked them, would you want to be called by your first name? So I was incorporating it. I wasn't adding on time. I was just making what I was doing a little bit more ethics, everyday ethicsy. Okay. I started doing things like when I would be teaching somebody, that maybe what I would do is draw a picture because I'm talking about it anyway. And I would draw the picture. Then guess what I do? I give them the picture to take home. People would come in years later with the picture that I had drawn because it mattered to them. So things that I was already doing, I started to do a little differently. Okay. Now that surgeon that I told you about, the 20 seconds, that was one of the most masterful things I ever saw because he's going to be talking about this anyway. And everybody watched that. And then they knew what that little boy had heard. So there are ways to do this that you can incorporate it right into what you're already doing. Okay. And to be thinking, and even to reflect on that, like, what did I do well today? Benjamin Franklin. Okay. Benjamin Franklin invented electricity. He had a practice in the morning. He would say, what good am I going to do today? What good am I going to do today in the world? And at every night, he would ask himself, what good did I do today? I started to do this. And what I realized was at the end of the day, it was like, what good did I do? And what I realized was when I connected with people and the patients was where I felt like I was doing the most good. So that it taught me that at the end of the day, some of these things are so valuable. It is not to minimize other things that we do, but these are remembered. If you ask patients 5 years after they were in the hospital, 10 years after they were in the hospital, what do you remember? Oftentimes they can't remember the medicines. They can't remember the exact diagnosis. They may not remember the surgical procedure. They knew they had a surgery, but they can't remember what it was. But if you ask them what you do remember, they're going to probably remember what some clinician told them, talked to them about, how they treated them years and years and years later. So the reverberation of how we treat people carries on. Now, for the hospital administrators here, this is all about the reputation of the institution. Okay? This is the organizational culture. You get the reputation, Hospital Garahan, they treat people right. They take that extra moment. Now, if you're really busy, is there a way to get somebody to help you with some of the stuff that maybe you don't have to be doing? Like the notes. I know in the United States, they're starting this thing with scribes. Do you have scribes here? It's somebody that is like a medical student, sits in there and types up the note while you can pay attention to your patient. You don't have that? They don't have it. Well, anyway, it's something they're experimenting with. Now, the patient has to be comfortable with another person in the room, but yet the doctors seem to like it. The nurse practitioners seem to like it because they said, then I can be looking at the patient instead of typing. So there may be ways, economical ways, that we could have more time with our patients. All right. Those are things to be thinking about. The other thing that I do want to say is that this is my personal belief. If there's ever a time, oh God, that's an awful photo. If there's ever a time when you do spend like that 5 minutes, you said, Carla, right? And let's say down the line, you need to make a very difficult decision with a family. The likelihood that they are going to trust you more is so much higher if you have invested early in the relationship. So what might happen is that later on, it could be a very good return on your investment because they trust me now. And if I make a suggestion, it's in the context of they know I understand something about them. I ask them what matters to them. So you see that it could actually end up saving you time, not just taking some time in the beginning. Most people don't realize that, but it could actually save you time in the long run. Those are some of my ideas, Carla. Yeah. Oh, yes. Okay, I'll just listen. Thank you so much for staying this few minutes extra. I appreciate it.
Muchas gracias, Elaine, por tu charla. Realmente me pareció muy enriquecedora para todos nosotros. Mi nombre es Fernanda Ledesma, yo coordino el Comité de Ética del hospital y la verdad que agradezco mucho esta charla. Creo que acá hay mucha gente del comité que ha venido a escucharte y para todos nosotros es un aporte realmente muy interesante y muy, como dije al principio, enriquecedor. Creo que tenemos la suerte en este hospital de algunas cosas buenas que hemos aprendido con los años, que los chicos tienen nombre y no diagnóstico, no hay número de camas, sino realmente hay nombres, hay familias, ¿no? Y esto creo que los niños son muy buenos maestros y nos han enseñado a quererlos y respetarlos. Pero coincido con que el tema del tiempo y el poco tiempo para a veces reflexionar sobre todo la ética de todos los días nos va en contra, así que probablemente tengamos que tomar algunos de los tips que nos enseñaste y llevarlos a los espacios de reflexión para poder avanzar en este tema que me parece muy importante. Muchas gracias de nuevo.
Thank you so much, but that is excellent because sometimes when you have your ethics rounds, we started to do, and Nadir knows this because he would come to them in the United States. We would have our sort of everyday ethics once a month, like a rounds, that we would go up to the unit and ask people, like, what are the challenges? What are you facing? How do you do everyday ethics? And then I would learn the tips from you, and then I incorporate them. But you're right, in these moments where we actually have some time to self-reflect on our practice and to build that muscle of reflective practice individually, but also as a culture, as a team, then we can learn. And again, to turn to the ethicists, like I said, help is there. Your ethicists, the psychologists, the social, people that can help you when you're not sure, how do I have this conversation? Simulation can also be another thing to practice with so that you don't feel so afraid. Like that little nursing student was like, I'm scared to death of having a conversation. So I hold the patient's hand. It's a good thing to do. It's fine. But that young clinician probably needs some help to practice a little bit, to maybe watch or shadow a more senior clinician, to feel like you take that young clinician under your wing a little bit. And remember, practice doesn't make perfect. No, practice makes better. And that we are all getting better. There's no perfect way to do this, right? What you do with one patient is not maybe going to work for another patient. So you have to adapt. But it would be wonderful to incorporate some of this. So let's think about the everyday ethics of this. Here's another thing. In our hospital, we find that if we pay more attention to everyday ethics, it is preventive ethics. It doesn't have to be a huge drama where now the doctors and the nurses are not talking to the patient. I used to get called in and I said, how did this happen? it doesn't happen overnight oftentimes. So everyday ethics can be preventive ethics. And the people on the ethics committee can be very helpful in, explaining these principles, or narrative ethics or virtue ethics. And it's a nice language to have at the end of the day. You feel like, I understand this a little more, because when I first heard of ethics, I was like, oh no, too complicated. Somebody else does ethics. Then I realized it does have to do with how we interact with our patients and how we talk with them, that every single one of us can be an everyday ethicist. Great. All right.
Y acá tenemos alguna pregunta que trataron sobre lo mismo, que decía cómo se conjuga el tiempo profesional, que es realmente limitado para asistir y proveer acciones éticas con los pacientes. Un poco lo que preguntaba Carla. That in the Zoom we already have the question again about timing there.
Yeah.
It seems common to think that time is of essence in front of having time to stop and think, right?
I started to think about maybe like the things that I did that I could be a little bit more efficient about, because at the end of the day, these things made me feel better and they made my patients feel better. So I started to think maybe I need to change my priorities a little bit.
Buenas tardes, mi nombre es Gabriela. Yo soy licenciada en enfermería. Primero agradecerle por su maravillosa presentación. Y me quedé reflexionando sobre esta cuestión de los aspectos que hacemos cotidianamente en el trato del paciente y que por ahí no los tenemos reglamentados sobre el impacto que va a tener sobre su calidad de vida, ¿no? Y también, si bien todos tenemos una formación profesional en lo que es ética, es básico. Y cuán importante es recordar todo esto día tras día en nuestro ejercicio profesional. Entonces, me parece muy bueno esto que usted estuvo diciendo sobre armar grupos de trabajo, tipo de coaching, de que nos apoyemos todos y evaluemos estas pequeñas cosas. Hoy, ¿cómo trabajamos en nuestra atención con el paciente? Hoy, ¿cómo fuimos con nuestra atención con el colega también? O sea, son todos pequeños aspectos que construyen el ejercicio diario de la medicina, de la enfermería. Así que, bueno, nada, era compartir y agradecerle mucho.
Absolutely. Yeah. Oh, absolutely. Thank you so much. Again, at the end of the day, if you say, hey, what went well? And then do more of that. And what could we do better? Because we know there's always things we could do better. And that's the way we carry it. Just like me, I say, well, that didn't go too well. Even when I'm with a family, has it ever happened that you're talking with a patient and then you can tell that what you said didn't land very well? What do you do about that? In the moment, you can say, I can see that what I said just upset you. Or I can see that something that I said, let me try again. Right then. What upset you? Can you help me to understand? This will save you time in the long run if you do this. Okay? So in the moment, when it doesn't work, let me try again. Sometimes you do have very upsetting news that you're sharing. Let me back up. Let me say that another way so that you can hear it. We're going to be talking about diagnosis of autism. That is a very difficult diagnosis to hear. Let me try again. Let me start with what your child does well. Okay? And what the challenges are. Let me be human about it. Okay? And compassionate about how I deliver this news. Okay, we got to go.
Thank you, Helen.
I think there's a reception, right? Thank you so much.
En nombre de Fundación Garrahan y Hospital y todos los presentes, por esta excelente charla que creo que nos ha venido más que bien a todos los que en cierto modo, de forma multidisciplinar, tenemos que incorporar todas las actividades éticas y muchísimas gracias. Te esperamos otra vez. Sí.
And I get to meet the ethics people. I'm so happy now. Thank you for coming. Thank you.
Sí,
Thank you, everyone.
el comité de ética está agradeciendo.
Gracias al equipo técnico, a Manu, a la gente de OCD que nos ayudó a estar conectados. Muchas gracias. Muchas gracias a todos. Le dejamos un tema que Elaine especialmente pidió hacia el final. Se los recomendamos. El tema de música.
Gonna make it right. And as I turn up the collar on my favorite winter coat, this wind is blowing my mind.